Ublacian Nunavut mute. Ublango yok takwa nuban la yo hak nu tat hitamo yut Nunavut luani. Amatad limat nuban na yo hakon ne tut mamihima yut. Katiluk ta luget man no yok 63 nuban na yo hak tut Nunavut luani. 62 Iqaluni amataw king 9. Takwa ta 176 nuban na yo hakon ne tut tayo mga tana Iqaluni nuban na yo ta law tulugo. 16,794 takwa nuban na yo taray kitumi kapiyo himayo hibud la fami 13,520 magwal sa kapayo himalaktu okay na taslong tana na ang idbadle raw yak taman ubdo tama ko gena ko ni mga na pigalo tabung hibuni kaptin tana hinu hibut adlang ngok palya raw yang man tana nuban na yo pidjitigilu tamani ingin na nyak tu yang man tamap telukta uwap ni menere chaluta nagligayap tinilap tin menere chaluta ikayok talugit amanunubu miu tiliok tu kanit cha pagata ko nuban na yo taray ko tumi kapiyo himangin nawit kapiyo yak to na putit ukaluglutit kapiyo lutit hibud la pami kapiyo gubit amakingud liani kapiyo na putit kana nuban na yo taray ko tit atud larigman timi muhung isluni na makluni tana kapiyo talo to kiheni tana nuban na yo halagene araptigo kapiyo himangin nawit kapiyo yak to tiliok tu charlo apaka amma takwa nuban na yo taray kutitana Pfizer tukirak himalagap takwa nutakanu ukiyo kakto no 12 to 14 mun na magtumit amigang ito ni tukirak himagap takwa nutakalukta kapiyo kulukit tikit na tuwak pata tayo pigya ko mamata tiliok tu chapa katakwa ta ukiyo li 12 18 mu kapiyo yak to kumapuhim manunumiyod matnakimayunga ko yali maklunga takwa nala chatarape amatay ko kapiyo yak to taktut tana ikayok tigigluta nagliga katigigluta tana halagina alwap tigo tan nuban na yak utak kachata mata tukihet charlo titaw ta ko nunubu miumat na kimapakat tamamik makingula pa mo kakkanang anigowit kinapak matuak himalutit agawang may talawit kanigilo ang tangiluta ay himameluta ublaluk tangiluta tana tiyan nakiheni ta nuban na yo ihulagatang niya matna. Today we are reporting 4 new cases and 5 recoveries of COVID-19. There are 63 active cases in the territory, 62 in Iqaluit and 1 in Qinghai. There has been 176 recoveries since the outbreak started. And so far, 16,794 Nunavut mute have received their first dose of the Moderna vaccine, and 13,520 Nunavut mute are now fully vaccinated. As we move forward with living with COVID, we need to all remain safe and vigilant. This virus isn't going to disappear, and it's up to all of us to keep ourselves and each other safe. I'm once again urging all Nunavut mute to book their vaccine appointments if you haven't already. This is absolutely the best and easiest and safest way to protect yourself. We have the vaccines, and we hope to have enough of the 12 to 18-year-olds vaccinated soon. Let's use every possible dose we have. That part is up to you and to all of us. Let's stay strong, Nunavut, and commit to keeping one another healthy. You know what to do. I've said it before, mask up, wash your hands often, keep 6 feet apart, and get both vaccines. We got this, and we thank you all for your hard work. Thank you, Nunavut mute.
Good morning. Due to a potential exposure to COVID-19 at the Iqaluit Soup Kitchen, the facility is closed today to allow time for staff to be tested. Depending upon results, the kitchen may reopen tomorrow. Here in Iqaluit, we will be widening our surveillance testing to include residential buildings that have had more than one unit with a confirmed COVID-19 case. Invitations to go for testing will be sent to people living in these buildings. These tests are voluntary, but if you receive a notice to get a test, I urge you to cooperate. This will help identify cases and reduce the risk of further spread of the virus. We will not be publicly releasing which buildings are being offered this service. Thank you.
Ulla sakkuta ko katiya hatuin na kaya hatu minuning inuwadyo anak 19 limita ko na ni kalun ni nirivinga ni soup kitchen nguna kaktayo mi. Tay na illo mi matumani apto ta ko yakana yakting ikaw isaktaw kayo na kulugin. Ta ko nalo na taw longin ningin ni ta na matuituin na kanirele kaupan. Tamane kalun ni ta ko people kanirtin na laktaw ikaw isaktaw katak ning ilagay yaw lutita ko Ilok jua katinga juni tako dalu na biusima view juni nuva jua nak 19 hakto minuning inni inata votako kaya kuya ila kaya saktaw hatta khulugi tako ninga illu ni tuni tako isimasun na to kaya saktaw gumaguti kaya saktaw gumangikutillo ni kasi ani kaya kataw ko kaya saktaw kuya uluti tayo maayaw to kaya kage kayo kataw kulutin taman na ikayong nahang na ang nalo na kataw kulugo tamako ano ba diyan aktulinig ulo kaya naktumitay likan ng titsinang bulo sa martay titsinang bulo no ba diyan ang mi tako nalang ang mga illo nito illo diyan ito katinga yun yung house rejang itavot tako ato inaview na to kaya saktaw gunang nangini ako yan na mi.
Kent Driscoll, APTN National News. Dr. Patterson, when you were talking about the additional surveillance testing, the phrase you were used was, people will be invited. How does that work? Is someone going to knock on their door? Is there a notice? Is there a phone call? What's the invitation look like?
Kent Driscoll, APTN, kuniluta Patterson, takwago, kaya saktaw kan nakataon ng nangata takwa, inataw niyang nakakabigay kano, tiluto biuluti ubalo kano kaya ikataw katang nakatamakwa.
Current plan is for staff to deliver notices door to door in the buildings that are going to be offered surveillance testing.
Tako kaya sak biu na to nilo jua ni katinga yun ita ko kanayak ti tiluto hatang na to ilongin.
And no, go ahead.
Nope.
Sorry. Actually, I'm not sure which one of you this next one's for, so feel free for someone to jump in. With the soup kitchen closed down, today the city is stepping up and putting out some meals for the people who would usually attend the soup kitchen. But if that soup kitchen goes down long term, that's a serious problem for the city of Iqaluit. I'm wondering if the government of Nunavut has any plans to help out the city or the society in order to keep that vital service running.
Tana niriyat to biu hatak to niriyat sa kalawa hatang ito no soup kitchen nguna rakta yu city kuno ila kamagiyaw diritit sikan ng nang katagawa singin no kisan ta na matumakutan nga kakaw ngilero tiuga yang kanu yuna bago makungi parnasi mabay kayo nang ningitay kuninga.
Yes, we're working with the city for food security. They have received food security money twice so far. And we're also working on a isolation package for Nunavut Mute that have to isolate as on top of what the city is doing. Itakwa city could pillar katigi Nunalipo could pillar katigi tartabu. Marwa so the kina mentuniyo himalak to letakwa nakakag changi to mekano. Mamana pillar katigi yabukina yung pinakan pikan ng natu aluit. Matakwa government could take anita liga akto muyunut mana Iqaluit ni mana hanabad liagaw yakto Nunavut Mute takwa anita liga akto.
Jackie McKay, CBC News. My question's for Dr. Patterson. The COVID exposure for the food center, can you give us a little bit more detail on what do you mean by that? Was somebody who uses the center tested positive, or was it a staff member? Can you give us a little bit more information?
Jackie CBC kunni tay kani nirigato bio hatakto mi soup kitchen mi khanu naluna kanero ikana yakte mi no gadjo nakta to hamna baluta ikunga pa hatakto mi.
It was a staff member.
Ikana yakte.
Thank you. And for vaccine rollouts in Iqaluit, I understand that we're doing about 100 a day, and that people who are booking appointments, that it's quite busy. I'm wondering why it's just 100 a day, and if the limiting factors have to do with staffing or building capacity.
Takwa kapiyaw hatta palle atillo itamani kalunni 100 ginang nilo tama kapisa hatta kunangata. Tamakolo init sa liyo kaswakto init sa liyo kunay lahat ngata sumay kanayak tikit sak ngata.
It's a bit of both, and managing the outbreak is important right now. And the other factor is that 4 weeks ago there were a lot of people getting their first dose, and now they're needing their second dose, but the demand for the first dose is higher than expected. So the the Iqaluit Public Health is looking at ways to increase their capacity to administer the vaccines.
Tamakki takwa siya mapalali law tilugi manaw yu amisong palali law nga takapiyaw hatta kumayo pinaso ako sa sita maw simayo takwa sivulak pa mi kapiyaw law Turliani maana kapiyaw valyalir ni kung ino amalo tako sivulak pa mi kapiyaw gumayo amisong simana ngino tako ikalun ni kumain ni nerbim me kawiga swakto tay mamisok kanong ni piyon ng mga ta.
And just to clarify, that is correct. It's 100 doses a day we're able to administer.
Dukisinak sitigaw 100 ginang nilo tama kapisikat ako nakto.
I can't remember the exact figure, but it's that or a little bit higher.
Nakamangita nga hatso mga tatanaw to yung nakailaw balo ami sunak sa galani.
Patterson, NTSC News. Are you able to say how many residential buildings are going to be part of that surveillance testing?
Tas tempatano na siya kung ni hatso yung mga tatako ilumyo kating ngayon ni kawya saktaw hatang na mga ta.
I'm aware of 4 so far that have been flagged as good sites for surveillance testing.
To sa mayo sita maniman na mono tako kawya saktaw hatabiyo na akto ni.
Do you have updated numbers on how many people in Iqaluit are isolating right now?
Hatso bay kalun ni man na manitele kuya si mayo.
There's 210 people in isolation right now.
210 man.
Trevor Wright, Nunavut News. I'm sure you probably would have mentioned it at the beginning, but what's the current status of the Pfizer vaccines that you guys requested?
Trevor Wright, Nunavut News kung nitay ko alitutsa si maya si Pfizer kano ilakan.
We're awaiting confirmation of the date when we'll get the first shipment and the size of the shipment.
Utak kayo ulungan ay hangaw laktit si biula mga tasibulak pa may tikititaw lakto ni.
Did you receive any updates about the situation at BCC or the Mary River Mine?
Tusak si mavino ta ni kikitalo mi kayok taw viumit sano ang malunuluya ni uyak na viumit sano.
BCC, as of this morning, has 3 active cases of COVID-19 and no new transmission on site for several days. The Mary River mine site, I don't know today's or the most recent numbers.
Kikitalo kayok taw viumit sulita ko pingasu nuwadyo anak to kato siya maunak to ni nutani siya maktukas mangitulog alaw si mayuni kisa ni mana mo to salaw ngiti nutani nuluya ni Mary River yang na biomit sano.
I'm pretty certain this is Minister Kusugaw's question, but you guys have a listen to make up your minds. Wondering about the timeline for bringing the elders back to the elders' home. Will that be when there's no COVID in Iqaluit, no COVID in the staff, or you have new staff in place and management?
Tana Minister Kusugao Kiunak Palayang Atako in Nepidutigi Titaula Kakanga good, Nupajonak to Haruni Kaluni Balekanayak the Hatsalikata.
Koyun na may tasuming apirigavit imaka tako tamaki atukon naksik pata taman na inutukay man na outlak titaw yagaya kalok tutagbangan inutukaw si Bingmi utir neaktut taikani pilere yuksait nama tjerak pata amanurunak si simalerupta awalat chiniaktuni nutanik taikani amma time na pila review yok man na inutukaw si Vic na yok daw kan nerun naksikpat nutangok taw yagaya kaktutay kani initlak si malakpata. I think it's a combination of a couple of things. First of all, we need to make sure that it is a safe environment for the elders to come back to. We are currently in negotiations to have new management in place and that the Elders Center is a safe environment for them to go back into in terms of replacing some windows, renovating the kitchen and cleaning up the facility. Then they would be brought back as soon as possible.
My next question is an enforcement question, and I know the Premier's been taking it. Premier Savikataaq, you seem to have some new numbers there in your hand. Can you tell me if anyone has been charged or fined under the public health measures put in for COVID-19? And I'm pretty sure you have the amount of people who have been warned, the amount of letters. If you could go through those numbers, please.
Sibulat Savikataaq hatsiw lang mga tanuta hatsiw ningit pasiyat sangok dito simayo balo inaktirar daw simayo anaham nang itularan ng mamalitaw yalin sa kumitsi simayo.
Okay, thanks. Yes, I have new numbers here. The total number of complaints is 119, and they're broken down into CPHO order breaches, gatherings, health concerns, isolation breaches, mass, outdoor gatherings, and unknown. I won't go into the numbers of each. And the actions have been taken is there's been 5 arrests. There's been 1 person escorted to isolation. There's been 1 fine, 1 relocated, 2 sent to enforcement, someone in charge of enforcement, 11 written warnings, and 36 verbal warnings. Itakwa naalang ito ni takwa kapeduktu na takwa naalang imata okalugbi humayupukak tali 119 uyu katikdugi takwa okaluk himayun amadakwa ilangit takwa hunamud namakang mga tao bulubo hunami pekoyang mihakomit mga tao itwa kay makika pekoyang inalang itut kating ngayut ana tayo tichi kut ihumaluk tut anit tayo yut aniyut kinapa matwa kimangitut hilami kating ngayut nakwa katituk talo 119 amatakwa huga kimang mangata tadlimat tiuyaw law ataw hek ay anit tayo koyo agjak tawlo anit tayo libing mud ubagwan unang le ataw akili titaw himayok ataw ka nutaw himayok mago ka menak hibut taikung outlook tita ila taikung ak titaw law 11 titakakot hunami hakomit mga ata ukaw jawyut 36 ukaw hikot ukaw jawyut Takwa Qajuqturvik with 76.
Jackie McKay, CBC News. This question is for who's best to answer it. This morning, Iqaluit said on the radio that there is a planned vaccine clinic between NTI and public health. Can anybody clarify more about that?
Who said what?
Iqaluit.
Alok ikuti kakao manalaw tiko tamakwa kapayo katang nimit sa ano. Kasi naktigyak tayo kung nakha.
Thanks. The Division of Operations in the Department of Health is working with NTI and other partners to and considering a mass clinic here in Iqaluit, and also some assistance from them in advocacy for vaccination.
Tako aulat sinang mapiliri yu dai kunani ane hanang ituliri kunni piliri hati haktu. Nunavut kunni asingin nilo katuji hatingin ni tako amisuni atau chiku kapisi hatang na mga tambalo ayaw tu igakan ni hataw ni ang meraktu kapiyaw hatako iluti.
Can you give us an update on the status of the Frobisher Inn and the clients isolating there? Are people still in isolation there, and is it going to remain open?
Tako ilika hanu ilika Frobisher Inn to yung mivimiani daily titaw yung sulitay kanito haka.
Yeah, there are still some people isolating there. There are 6 people in isolation at the Frobisher right now. The rest of the hotel is remaining open for regular use.
Sulitay kaniyani daily titaw yung hatu. Manaw yung 6 ng yung Frobisher Inn mi. Kasi anitaan na tuyok mi viasingin na tuktaw hatta kung nakalawas ni.
Patterson, NZAC News. When it comes to percentages of populations that are either unvaccinated or only get 1 dose of the vaccine, are there generally accepted standards? For example, like X% of a population may not ever get vaccinated?
Dasan Patterson at siya kung nitako presenting ihatsi ni ita kapayaw si mayon or kapayaw si mangito sibulik pamilo ni kapayaw si matuy nakto kanu taman kapayaw si matin nagi nalunay ako.
That depends a lot on if it's a vaccine given during adulthood or if it's given when people are children and are regularly seeing physicians or regular seeing healthcare practitioners, and it's part of their usual schedule. So in the case of COVID, none of that really applies.
Tana kanu itu mga takapayaw gutigi hatak tangin innaw tillugi sokusi tillugi luni tamakwalo ni ana hamnang itulir na mo kanayak ti kapayaw gutigi gayut tangi kisani tamakwa pidyo tigi lugi no vadjana 19 mo tamakwa atu ti hangit.
Last week you said that health staff were stretched. Where are we at with that now?
Pinasa ko si yumita ko amigas si valalag ningin ni iqanayak ti manal kanu ilqa.
So public health staff are still a bit stretched. They're working incredibly hard, 10 to 12 hours a day, 6-7 days a week to respond appropriately to this outbreak.
Tako ana hamnang itulir na mo iqanayak ti piyat sa kalaki nakti iqanayay nakti lutama ikakani 10 to 12 no pinasa ko sin iluan is 6 to 7 days. Oops. Uluni.
Trevor, right, Nunavut News, can you say how many people under 18 are still active cases, I guess?
Trevor, right, tako hatsi ka 18 tungani tui nuwadjo anak tuloy.
Since the start of it, there's been 59 cases in children under 18. 16 have been diagnosed in the last 7 days.
Te mga pigay yung mani 59 o si mayo isuko si ukiuli 18 tungani no vadyo nakta si mayo amalo 16 o si mayo ulo ni saiba o si mayo ni.
The way the virus came back in the same household in Kingate over the weekend, with the after the previous case recovered, should households here in Iqaluit be wary or be careful about that or consider that?
Tako aking am ni ilumi o hatigi ni sa makta yung kalaw nga tayo matsay na kalun ni tayo may sumalu ta kaya ilumi o hatigi sa makatigi gunam niya.
So it didn't come back, it actually just didn't ever leave. So what happens is that people are infectious for up to 10 days while they have COVID-19. And if you, after exposure stops, the other people who haven't been diagnosed, they could go up to 14 days of incubation.
Ita nauterning itu kisah ni tawaning naktumini tayo mga ulo ya kulit nuvat jo anak tato kaksimalaw tilugot tako ilumi o katigi kano igum ni kalawak tilugi asing kisah ni ulo ni 14 ni sulit timingan igum nang asang makun nakto nilo.
That's why it always takes a long time and is often difficult to predict when people are going to finish isolation when there's an entire household that's been exposed and is living together.
Tayo may mayong nakayuto ako niyo kayo katasunil tamak ko kano ilumi o katigi kano kangako ni teli kung naksigayang mangata.
Kent Driscoll, APTN National News. Dr. Patterson, today's the first time in about a month where none of you have mentioned partying in your opening statements. I'm wondering, is that situation getting any better, or is it just not something we were bringing up?
Kent Driscoll, APTN ko niluta Patterson sibulak pa mi kaus kangita sa tayo nakatsi party katakto ni tayo ma to sa kami naksima tayo may katakong niya ngataw balo kaus kangito yung naktasi.
It's less of an issue than it was. We've the last few days, the number of new households being involved has dropped dramatically, and so that's good news. And obviously, we want everybody to carry on with what they're doing right now.
Taman na sumalong naunir naksaw si mayo ulugalaw-law nga tani maluhat siyo katam ni katat si mabali laki mata taman na to sa kami natsiyak to taman na kayo sigutaw kutsiyak tabo tayo makati katak tayo litit sinang mi.
Dr. Patterson, one of your reasons for keeping the beer and wine store open throughout this was it prevents people from going to bootleggers' houses, which would not be as secure as going to the beer and wine store. You could apply that same reasoning to the new marijuana dispensary on Federal Road. I'm wondering, does the health department have any plans on allowing them to open on a limited basis for the same reasoning that it would keep people from in front of the stores and going into other houses?
Luta Patterson, o kakong naki sumatay na beer, wine tabi, niwag bisuli matuwing ang mga tukisinak galaw ako sa kumitsi sumayok ko melo ni niwag sa kaktit hailid ng mo pidyo tayo galaw kisa nilitay na milut simi angayam na to niwag bitay matsay na matuwing agum naktut sa umiyo galaw tayo may sulit ang bekarlo ni tayo mga tuwing na niwag ako kakatta ko nago.
The other part to consider is that withdrawal from or sudden loss of access to marijuana is not a threat to somebody's life or safety, whereas alcohol withdrawal can be quite dangerous. And so that's the other important part to consider in keeping the beer and wine store open.
Taman na sa magiyaw gaya kami may mga timitin no ayuli ko ta kasi matillo ta milut simi angayam naktunitay ma ulugay nang nginnek sa milut sigum ni kay naksimantillo gi kasi nili melo hattatu itimi mino ayo kultur kaksimayu ulugay na laki gum nang inusingin no timi nga nullo tay may mata na matuing nga laki titaw hattako beer and wine store.
Jackie McKay, CBC News. With more and more people being vaccinated in the South, is it going to impact the isolation hubs?
Jake KCBC kunni amisuunersai kapiyausimat lirtillugi asidserniusavaataakua qallunaani anitteiliviukainnarattartu tuyermivinni.
As more and more people get vaccinated, it's going to help control outbreaks in the South and the pandemic in general. So eventually it'll reach that point where isolation is not necessary.
Amisong palangin natillugi tamakko kapiyaw kattartut ammalu saama pallanirmuut qallunaani tamanna Iqayuuti haqtillugu saamaqtailitit sinirmu tamakko anitteili viu kattartu qallunaani atoriaqarunniituinnala riaqalaartussavunissattin.
Lots of people have been asking, seeing restrictions lifting for vaccinated people in the South and wondering why we're not getting the same liberties in Nunavut.
Amisapari vallea hattalinga tamakko insulitan biutitayo khasuya vallea tillugi pidjutigillugi kapiyaussimaningi summalita manunavumita meingitpita.
We have higher proportion of people that are not vaccinated and can't get the vaccine, so the risks are different for us.
Taakko amisuunersa mata kapiyaussimangittui maani ammalu kapiyaugunnangittui taime maulureanartuminnersaugattassule.
Just when you say that higher proportions of people can't get the vaccine here, are you talking about because of our population is being so low, or are you talking about adults?
Taime ilitilluti amisuunersai kapiyaugunnangin matakkissumi pidjutaqaravi.
It's a couple of things. Number one, there's a higher proportion of people under 18 in Nunavut than any other jurisdiction in Canada.
Taakko amaqquulingayu sivullerpaa taakko amisualu matauvikke ittiinni tungaaniittui kiuli taima kannatamita kullugi.
And we're still trying to get not us specifically, but globally, there's still that effort to measure the impact of the vaccines on the spread of the virus. And so knowing that one simple introduction in any of our communities can trigger a significant outbreak like it has in Iqaluit, we want to be ensure that we're as careful as we can be before we take that step.
Tamani ila nunarjoami ila suliqawi sartavallama qanuattuina harunnarmanga saamaqtailititsinnermu taanna kapiyau qattarni pidjutigillugu taima nuvajoanartaartuharneqqaat saamaqtuni suurliqalunni ujjersutsiaraaqatta tamanna ismagijaulaunginninganni qassuvallaatitsini malittaugalin.
Tech News. You said that the household spread has slowed. What are we looking at over the last couple of days, and how does that compare to, let's say, a week ago?
Kastam taanuna tsakunni illumiuhatigini saamapalleanginneqsauneraileraviulluni maqquussimayuunni hanuatjiungila pinasaarussiulaortumini.
For the last few days, it's been either 0 or 1 new house a day, whereas last week it was usually 4 to 6 new houses per day.
Pitahangit saamaqhattartu saamaqtuni ubbalu ataussituarminutaami illumi saarmaqbiuyuqaqattalertu pinasaarussiuyumilli illumiuqatigiingittuni 4 balu 6 mu saarmaqbiupallaaqattaka innaliyummata.
I'm sure who this next question's for, so I'll let you figure it out. For the first month of this outbreak, there were warnings issued. Now we have 5 arrests and at least 1 fine. Can we have any details on what those arrests or that fine were for?
Tana saamapalleani ussimala taqiussimayumi tallimani tigujaussimajaqartu ammalu akilititaujuqarsimayu taakko tukissinartigiarunnaqqissiu.
Thank you. For the arrest portion, you have to ask the RCMP. We're not in charge of that. And I just lost. bear with us.
Sorry. Want me to do?
Which one here?
Okay, so the fine was related to an individual who was COVID positive, who was seen out in the community breaking their isolation period.
Nakiliti daw sa mayo, Nunavut 19 haksuni ani katattuminiuning ano.
Maday ko tiguyolo ta ko pukertuling no kawi ga tu lo tu ta hunu tiguyolo mga tata na kawi mangita.
Trevor, Nunavut News, questions for Dr. Patterson? Just wanted to clarify what kind of residential buildings you're going to be testing. Are we talking mostly apartment buildings and such, or?
Trevor Wright, Nunavut News ko nito kisinaktige ako tako iloy katingayoy kisu mga ta kano nalunay kaniki apartments ngoba.
These are apartments or row houses or condominiums, any building where there's 2 or more residential units in the same building could potentially be a good site to have a surveillance program.
Nita ko katingayoy iloy apartments umbalo katingayoy mako ni nga tanulo ni katingayoy ni ilutali.
While we're sticking to the 2 vaccines for now, have you guys given consideration to the other vaccines that are out there, and why was it decided against so?
Tako kaputi pijuti giluya singin ni kaputi ni sumasaksiyo ti haks mabiyo balo sumasaksiyo sumangiko summan.
Because of the logistics of incorporating another vaccine into our program, it takes a fair amount of work to do that and doesn't add much benefit to us except for with the Pfizer, where it gets us, allows us to vaccinate a much younger group of Nunavut.
Tako akaw na lo kayang mataas tingin ni kaputi ni pikaswak na kupta pilirang uga kamari kayang ataman nato te kalo kayang makisa nilita ko Pfizer pikaswak ta bumakut tunuta ko litag asigi nga kayak tangi kaputi.
Ken Driscoll, EPTN National News. Dr. Patterson, the individual the Premier described as walking around Iqaluit with active COVID and having to be picked up by the RCMP, contact tracing obviously followed that. I'm wondering, did any of the contacts from that incident come up positive?
Kentus ko ipigtiyan kun nita na piso kayak tumini akalaw ni Nunavut anak to hak tuni palisik kun nuti guyaw yumini katija hap tumini uning ani kaw isap taw law tut sa ama katija miningin ni Nunavut anak tak to ham nakha.
No. Okay.
And I'm also wondering, and if this was asked already, forgive me, sometimes these things do tend to blend together. How many people have been sent south to be hospitalized, and what are the condition of the people who are in the south?
Takwa khatsiuva nerbilak titaw sa mayo kalunano.
So there's still just been 3 sent south. One of them remains in hospital in the intensive care unit, but apparently has been improving a bit over the last 48 hours.
Insulita ko pingasu yo nitsimayo kisanita nataw sirsuli inuli saktayo kisanigo hanigo ni pala kapsulak tugalo.
Jackie McKay, CBC News. Right now, anytime a community gets a case, we go into a full lockdown. Are we ever going to get to a point where even if there's active COVID in a community, we'll still have some restrictions lifted?
Jackie McKay, CBC kuni mana yo tayo matusima mataki sutuin na sama pala ni pijutigil lugu tayo Nunavut anak to kakalawak tilugu tamakko kasuyo bala gayam ningin ni sumanakha.
Yes, and the more people that are vaccinated in a community, the less need there is to be so aggressive with the public health measures. The other thing to remember is that the sooner we identify cases, the also the less benefit for these public health measures that there will be.
Sai kapiyaw sa mga valelo tilugi dahil mata ko anaham nang ituloy ng mumalitaw gaili at agayatugun niya palala tugalo kasi anito kamagya hamigo kilamiw na sa nalunar sa katakot tamak kuning hawiyaw kataktuning tamak ko kilamiw na sa ko hayok kasuyaw valyanak sa gun na latui.
Mayor Kenny Bell is saying that the soup kitchen is open and it's currently being run by city staff. So can we get some? Is there any way we can get clarification on what's going on?
Tanago Mayor Kenny Bell hasimama tana nirivik soup kitchen kanayak tingin no awlataw ma kanova.
I've heard the same thing, that there's some service being provided right now by the city, and I think we should all be grateful for them for taking care of that, but I don't know the details. I do know that the staff who are regularly there are off today while we sort out how or what the chances are that they've been exposed to COVID.
Tusagalat si maya kalungan tayo mga kanaw kaya pitsirak taw ningin no silik kuno tako huyaligyalibo kasi ani kanaw nalunay ako ting iluling hawya mangitak kasi ani kanaya kayo tuman kanaya ngito hawya saktaw bala ningin.
How many contacts per case are we seeing now?
Tastan petara nuna siya kung nita ko aman na katsiulak katiyaw kayo kataktoy.
The outside of the non-household contacts is the average is between 1 and 2 per new case.
Tako ilumyo katiging itangin ni katisiga yo katakto man na yo ataw sa mimakaw nilon ni.
And then when a case gets into a household, are we seeing that it's typically affecting everyone or just some individuals in that household?
Tako ilumyo katigin ni no badyo naktato haktilugo tako ilo na ilumyo katigin sa makbiyo katakha or kano.
Our experience right now in Iqaluit is once it gets into a house, it's going to infect probably about 3/4 of the people who live in that house.
3/4 is over half?
Yeah.
Tako ilumyo katigin ni ikalun ni sa makto kakay ma abang ata unga ano tako ilumyo katigi sa makbiyo katakto.
Trevor, Nunavut News. Do you guys have any more details on the planned mass clinic, or is that still being hashed out between you guys?
About what?
The mass clinic with MTI and public health.
Tako Trevor right Nunavut nga wikulo amisuni kapisiga so akatalam ni sino ilulingin ni kayo mavi.
That's still being worked out.
Suli pang nataw yu.
Premier. Earlier this week, you mentioned a food security package, and you gave it a mention today. How is that going?
Taman na nariyat sa katsatit sinamo kino ya hatit sinamo kano taman na lumi mo kano ipa.
We're still working on it. We thought it was very simple, but it's in terms of logistics of getting it done, it's a little more complicated. But hopefully on Friday we might might be able to have an announcement on it. But some hampers are on the verge of going out, and some may have gone out. Itana anita ligahan no ikayuti ayaw nang nanguyalaw tulo kaya ayaw nangayang man maka tadlimani faidimi ubulu mandimi tu kakayak tugutana ano outlang na mga ilangin aglat man na pihimayun pihimak hinna realita ko ikayuti ni tana aniteli yun nubu miyuno ta tokangan niya